4 factors in ADHD diagnosis. The crucial concern for parents of children with ADHD, attention deficit hyperactivity disorder, symptoms is to get a correct diagnosis. The big challenge in such a situation is that a child should not be underdiagnosed or even overdiagnosed for the disorder. Since there is no single exclusive test for the diagnosis of ADHD, a multi-pronged approach is called for, that also entails the involvement of the parent, teachers, and other caregivers. The symptoms of hyperactivity or poor attention may be mistaken for other disorders, which is why an in-depth assessment is of paramount importance. The key factors that go into the making of an accurate ADHD diagnosis are as follows. The intensity of the symptoms. While the primary symptoms of ADHD that drive a parent into seeking an ADHD diagnosis in their child are hyperactivity, impulsivity, and lack of attention. The severity of the symptoms is of crucial significance in assessing the disorder. Generally, for an accurate diagnosis, the child should exhibit a minimum of 6 out of 18 or more signs of inattention or hyperactivity. To be diagnosed for the disorder, the child must not simply exhibit these symptoms, but they should have a discernible negative impact on the child's life, i.e. on his home life, school life, and on his relationships with his peers. For instance, inattention should have caused a considerable fall in the child's overall grades in school. The child must display serious difficulty in completing homework or classwork over prolonged periods, etc. To ascertain this, an ADHD specialist needs to take the big picture into account by scrutinizing the child's conduct in a vast spectrum of situations. Doctors who conduct only a superficial probe, by making only shallow inquiries about the child's case history, are not likely to arrive at an accurate diagnosis. The onset of the signs. The mental health professionals take into consideration factors like how early the symptoms surfaced in a child's formative years. One criterion is to examine if any of the symptoms appeared before the age of 7. This can be quite a challenge for the parents as well as the doctors, since in kids below the age of 4 or 5 the diagnosis is made difficult by the highly variable nature of their behavior compared to children in an older age group. Another challenge is that the symptoms of inattention in toddlers or preschoolers are not easily discernible, since these kids face a few situations that call for constant or prolonged attention. Duration of symptoms. One major criterion that specialists bear in mind while diagnosing ADHD is that the symptoms should have persisted for at least 6 months prior to the diagnosis. The symptoms of hyperactivity, impulsivity, and lack of attention must have been present for at least 6 months or more in more than one setting, like the home, school, playgroup, etc. The factors that a specialist will look at are whether these symptoms are long-term, are they of an excess degree, do they occur more often than they do in other children of that age, are they the result of an ad hoc adverse situation, or they are born of a more permanent problem, and so on. Settings in which symptoms surface. For an ADHD diagnosis, it is significant that the symptoms should manifest themselves in more than one setting, like a classroom, play school, home, social occasions, etc. The mental health specialist has to take into consideration factors like the child's conduct in class, interaction with other schoolmates, reaction to figures of authority or discipline enforcement. If the symptoms surface only in one setting, an ADHD diagnosis is generally not given.